We have noticed the trend of increasing demand for healthcare services, and in the last few years we've actually put in place plans to expand capacity of our healthcare sector, particularly in terms of hospital, community and nursing home beds. In fact, we are working very hard to facilitate timely discharge of patients to the community hospitals or to nursing homes, and that's why it's important to also increase capacity there so that there is right siting and therefore allow other patients with more acute needs to be admitted sooner into our hospitals. Besides that, actually the hospitals have been actively putting in place providing or delivering services beyond the hospital walls. So in terms of some hospitals, for instance, provide transitional care team. So the transitional care team, which comprise doctors, nurses and other allied health professionals, would help to look after the patients in their home, to facilitate smooth discharge transit into the home, and help to ensure that the patient's condition doesn't deteriorate, so that they will not be readmitted back in the hospital. Then we have also interim caregiver services, because sometimes discharge is delayed because the caregiver is not ready or cannot cope, and therefore they ask for a delay in discharge, which actually intensifies the bed crunch problem. Some hospitals have actually gone even further upstream. They've actually looked at identifying patients who get frequently admitted, failed patients, and then look at providing them again with advice, monitor them, help to control their conditions so that they don't get admitted into the hospital. And in fact, CGH, for instance, is going to launch this partnership with GPs, where if the patients, after they are triaged and they are determined not to actually need A&E services, they will be referred to the GP, who will then take care of them. So these are some of the proactive measures that we are taking to address the bed crunch in the interim, even as we are ramping up our capacity.